really here to start building a bridge within the care community. We have our traditional mental health care providers, we have our doctors, our nurses, and all that. And then on the flip side, we also have us healers, the Reiki masters, the hypnotherapists, um, the list goes on and on. So for me, myself, I actually got started in allopathic medicine, working in doctor's offices and hospitals, alongside the care teams there, working with the nurses, the doctors, the administrators, and all of that, and really dove into the patient care aspect of it. And but after a certain amount of time, I started burning out. It was like, okay, I could see so many gaps and none of them was being addressed. And so I just was like, okay, that's it. Got to try something different. And had a few odd jobs here and there before I found Reiki. And once I found Reiki, it was just like, man, kind of like coming home. There's a sense of just coming home. And so I just followed that thread of thought and kept going. And over the last about 10-ish years, I've been a student of Reiki, a hypnotherapist, past life regressionist, um, and also over the last 4 years, I've really been studying shamanic healing practices as well. So I've really dove deep in there. But those roots in Western medicine never went away, you know. So um, last fall, I met a woman and she really inspired me to take a new step moving forward and see what happens. And this is where we're at over the last 9 months, working diligently. I can now officially launch our program, say hello to everyone, and see what happens, right? Our mission is basically to build a statewide network that strengthens connection between the healing arts practitioners, mental health professionals, healthcare providers, as well as communities. All these rural communities, you have little pods of healers here and there, but connecting them, that's the difference, you know. And so our purpose is really just to bring in meaningful collaboration, increase access to the healing arts, including hopefully one day healing artists will be able to be referred to by doctors and nurses and counselors. Um, and we're creating spaces for education, dialogue. So this month we have a couple roundtables for healers coming up. And overall, we're just trying to build a new form of communication between all health practices because it's time. It is. All right. So, our vision, this is the model we're working with. We're working on building a statewide practitioner network. So, some of you may have gotten emails from me or messages on Facebook or wherever. Education and community conversations, collaboration opportunities, connections between practitioners and professionals. So later on, that is something we'll be doing is bridging the gap. That's our main theme is bridging this gap between the healing arts and traditional medicine. So we're also building pathways for recognition from Oregon Healing Authority. And once that is stabilized and built, we'll be able to start working with health insurance companies to get compensated, which means that more people will be able to enjoy the healing arts. But in the meantime, what we're going to be doing is building a scholarship fund for people who are interested in, say, learning Reiki or hypnotherapy. And then also for low income clients, say, they can only afford one session, but they really need three. They can apply for scholarships so that we can, they can get the care they need and the practitioners can get paid what they're worth. So this impacts, so this whole system we're building is impacting, of course, the healing arts practitioners. And that means independent practitioners, wellness groups, and community-based hubs, metaphysical shops, healing arts communities. And I'll, we've always been talking about collaborating and doing all this, but it doesn't seem to really happen. It all just kind of ends up in a little pot. And so now we're at the point where it's like, you know what? Let's officially get people introduced to each other. Let's build a framework so that healing art practitioner pods can start communicating with each other. And these all include, like, let's say, somatic therapists, energy-based modalities, mindfulness, Ayurvedic dietitians, sound and vibrational healing. I mean, the list goes on and on. And then, of course, on the other side of the bridge are the mental health and healthcare professionals. So, just as you know, we got therapists, counselors, social workers, physicians, nurses, and the list goes on and on. Um, and then we have the communities and individuals, so people out there, the general public who has been interested in asking but can't afford it. We have cancer patients who are interested asking but can't afford it. We have elderly care who they probably don't even know it's an option to them, but we have death doulas out there. We have all sorts of different type of things for elderly care. Like Ian knows specifically, he's a caregiver, and he knows the impact of how Reiki might help in certain situations. And then, of course, families, children who have been really sick and the families who are just overwhelmed, burnt out. It's great to give them Reiki or mindfulness or something like that to help them move through it. And then, of course, these rural areas, some of my clients are from rural Eastern Oregon, way out there where there's no healing arts hub, there's no metaphysical shops, but they're still looking for it. And then all the other people out there who've been constantly saying, I'm going to counseling, but it's not helping. I'm taking all this medicine, but it's not helping. And then they come to us and they're like, there it is. And there we can fill in the gaps. So it'd be nice to be able to be part of that care team, right? And then, of course, the students and professionals, that's where scholarship funding is going to help out. So we have big plans there. Our role is just basically it's an uphill battle, but try to work with people to get them to move towards the same goal. And the goal is easy. It's just connection. It's just building pathways and communications so that people are able to navigate a system in a more healthful way. So that means we're, working towards sharing understanding, sharing resources, having meaningful conversations about collaboration, and just starting to build those bridges and put systems in place where all of us can help an individual. So how there's those electronic medical records. It'd be nice if healing practitioners can tap into those somehow. Okay, so here's the care plan that the doctor has. Here's the care plan that the therapist has. Here's my care plan. And that is it. It's as easy as that. To just bringing it all together so that the whole person gets to experience everything they need, mind, body, spirit. If one's out of whack, the other two will never feel imbalanced. And that's just the reality of it. And so this is like we're doing tonight, is creating spaces to bring people together, to educate them, let them know, hey, we're here, we're starting this movement. We are working to make a significant change. And the reason being is, haven't we been talking about healthcare reform for decades? I mean, why not, right? It feels like the right time to bring something in that's never been tried before. So that's another thing. It's like, okay, this is a whole new idea. Let's see what happens. And so, like I was just kind of perusing through, I'm not going to stay on this slide for too long, but really, like I said, the connection, educating, collaborating, and advocating. So, working on reducing isolation. And that doesn't necessarily mean in rural Oregon. People after the pandemic have not left their homes, and having their therapists or doctors say, hey, you can get on Zoom with Ian. He's a Reiki practitioner. um I mean, that kind of starts bringing them out of the fold, um building networks, creating accessibility between the fields. And so we want to be able to share the understanding, reduce misunderstanding, and that's what we're definitely striving towards. I think I have kind of an interesting balance there, because I did work in Western medicine before, and now I'm here in the healing arts. I have the language of both groups. So hopefully I will be able to find more people like me, and we can all be translators, and there we go. Pretty sure it's not going to be that easy, but it sounds great, right? Um, and of course, collaborating, I've mentioned that, and advocating. This is where we're talking about awareness, bringing it to the system level. So when I mentioned Oregon Health Authority earlier, this is what I'm talking about. I've already got my foot in the door with them. I've had a meeting with about 5 individuals, and 2 out of the 5 actually already knew about the healing arts. And so they have become champions for me to start developing a relationship with the Oregon Health Authority, which, if that works out, is going to be just transformative for the systems itself. So this is what we've already done. So we've already established our framework. We've created the statewide initiative. We've developed our mission statement. We have been connecting with healing arts practitioners and mental health professionals already. I mean, we just had a meeting with a woman from the Anita Clinic yesterday, and she was just amazing. She was excited to know that we're doing this. She said she already knows about the healing arts, but doesn't know how to speak to it with the other therapists in her group. Because she's like, I already know about it, but I don't know how to tell them that I know about it, that I believe in it. And perhaps maybe we can get in there, talk to them, and more than one of them will know about it. They just didn't know they could talk about it with each other. So these are just examples of little frameworks we're building with, and building those community connections. So starting those conversations with all those professionals and being able to identify those shared interests, um, being able to identify our shared challenges, and then bring in, hey, look, okay, every challenge is a door that you can open. It really is. It's an opportunity. You can either turn away from the door or you can open the door and see what happens. And here we are, opening the door. One of the other big things we've been doing is advanced legislation and recognition efforts. So I have had several meetings and one-on-one sit downs with the Oregon Chair of Mental Health, Rob Knotts, and we've talked about, okay, how can we get um, healing arts practitioners formally recognized? How can we build pathways for insurance compensation? And so and then also how can they help us because they really are the head for Oregon Health Authority. How can he help us get in the door with the existing healthcare systems, the Oregon Health Authority? And so we're working on some legislative bills for next year for an actual um, Healing Arts Practitioner Access Act and as well as recognition. And so it's kind of a tedious balance because regulation is definitely always on the back of our mind. Like healing arts are so used to being freestyle that having heavy regulation is definitely not on the table for us. So that is um, something that Representative Noss and I go back and forth with a lot. Um, we have created conversation opportunities. So we're going to be doing the roundtables for the healing arts, and then we're doing the roundtables for mental health providers to start with. And then we'll bring everybody in the same room. We'll have the healers and providers all in the same room having a round table. Later on in the fall, we'll be entering the hospital systems where we'll be having, let's say, like Reiki clinics where nurses or medical assistants and doctors can come in, get 15, 20 minutes of Reiki so they can feel it themselves. Maybe, a little bit of hypnosis or mindfulness if they're having a stressful day. It doesn't matter. We'll let that unfold later on. And that's where we're going to need some help is people bringing in their ideas. We've also developed engagement pathways. So we've been putting out surveys and different forms of outreach strategies. So social media is definitely one of those big things that we can't get around. That's how people communicate nowadays. So we're building a social media team where we have a storyteller, we have a digital artist, and then we're just going to keep growing from there. Um, and also, some of these engagement pathways actually include students who have been just a blessing. They have a set of skills that a lot of us don't. And it's amazing that they are willing to step forward and bring their skills and be excited about it, or at least I hope. Um, all right, moving forward. Why now? So right now is the perfect time. Like I said, we've been talking about healthcare reform for a long time. And then I have been calling the last couple years myself the Great Dismantling. And so everything has gotten shot to hell in one form or another. Doesn't matter. I'm not bringing politics in, but that it doesn't matter who you are. We've all felt it on a personal level. And I want to be a part of this change. I want to be a part of rebuilding this system. And so right now, we need these accessibilities, these whole person approaches. The system has been fragmented for too long. Actually, I don't know if it's ever not been fragmented. Um, and so this is our moment. We're stepping into this opportunity to show our interest in integrating and collaborative care and see how, it's something that I have noticed is coming, healing artists in in certain areas have been like, no, 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 I don't want to do this. I don't think this is a good idea. But really, if you think about it, it's not about us. It's about the public out there who needs us. And this is going to be a really big way of getting our services out there to them. And so that's really one of my big motivating factors is remembering this isn't about me. It never has been. And so let's frame something around that concept, right? Okay. So Oregon, we're doing it here in Oregon because Oregon has always been a place of innovation and collaboration and community leadership. There are nonprofits all over Oregon, um, grassroots leadership, so many different types of avenues of helping each other and helping the greater good. There's lots of different diverse communities to work with. You know, the whole BIPOC and the LGBTQ plus communities that we work with as well. And so, with this growing interest in integrative and complementary approaches to wellness, being open, being excited about the process. If you haven't had a chance of experiencing Reiki or hypnosis or going to a sound bath, oh yes, you definitely should. And you'll understand why then. And so our long-term vision is a statewide practitioner network. And so hopefully within the next year and a half, we will have the funding to build an actual registry. So this registry is going to be connected to the Oregon Health Authority and to which means that if a doctor is looking for a healing arts, they just log into their account and there we are. They can pick from that pot there. And so that's where a lot of the grant funding will end up going is building a registry so that we can connect the practitioners and providers and we can connect the general public out there too. They can log on to directory sites and you know when you go on your insurance card it says provider lookup, you go on there, boom, we'll be on there too. And so that's definitely one of the big things. Education and community conversations. So, like we're starting this summer, are the workshops, the roundtables, the all learning across all the fields. So we have just meetings going to be lined up over and over and over with. Right now, we're starting with mental health clinics and providers. And so, like I said, we had one yesterday. We have two more lined up for next week, maybe three, and they're just starting to roll in. So it sounds like they're actually more open-minded to it than we thought, or they are also ready for a change. And so that's where we're bringing in that cross-discipline collaboration. It's got to start with us. They didn't even know. It's not their fault. They didn't know that they could build a bridge. And so we're going to be taking the lead on that, carrying the torch and just going for it because we deserve to be recognized. We deserve to have access um, to people. We deserve to be paid our compensation well. I mean, I'd say, you know, 2 out of 10 of my clients actually pay. And so, I do a lot of work for free, and that's very common in the healing community because, the people that know it's not about us, it's about other people. So here we are. It's time for us to be able to be compensated as well, because money is not a bad thing. It's just energy. So we're going to figure out how to explore the those pathways for the broader access that is mutually beneficial for both sides of the bridge, which means that the access to care just in general be exponentially expanded. Like, let's say you go to a dietitian and you get these great meal plans, you get all this, and then you start doing this diet and you're like, meh. And then someone says, well, why don't you go see an Ayurvedic dietitian? So you go to this Ayurvedic dietitian and they map out, okay, they gave you this meal plan because this piece of broccoli does this to your body. Oh, okay. Now I actually want to eat the broccoli. It's collaborating. Those two little pieces could really build a whole, get people to build new lifestyles for themselves. And I truly believe that, every individual that starts rebuilding themselves, finding those little changes in themselves, we will have a tipping point in society where all of a sudden the drama we see now is a thing of the past. It's not going to come back because the energy of society has shifted. And I would definitely like to be a part of that.
I totally agree with you, Jamie. Thank you again for having us all here. I think it is the right time. I think a lot of people have lost faith in Western medicine. They see how much money's put into the into the healthcare system and how unhealthy we are. I think there's a lot of healing, and I think food and supplements are medicine. And those can be prescriptions just like anything else. And so can, I think of a Reiki session could be a prescription. Have an energy wielder help wield your energies. Clear up some blockages. I mean,
Mhm.
I
Let
think
me see
it's the
what I
right
think.
time.
I think so too. And that's why we need help. You know, we need to bring people in to help us make this lasting impact, to help us build these meaningful connections. And it's not just about that in a way when it comes to volunteering, because you're also growing your own skills. You're learning new skills or putting the skills you already have in place and doing something with them that is going to help shape a different future for everyone. That it's I just get so excited that sometimes I lose my train of thought. I'm like, I know this will work. And so I'm going to stop sharing for just a moment. And if any of my volunteers would like to pipe up, say hi, introduce yourself, and what you've been doing for OHAN. So, yeah, anyone want to step forward?
Yeah,
Who's going to be first?
I'm about to say I'm looking at my other screen here so I can see everybody, but I'm one of the grant writing volunteers. My name is Frank. I volunteered through the what was it, OHSU website, and I found OHAN, and I thought it was just a great idea. I mean, as I'm studying the health services administration in the United States, as Ian said, we're spending way more than any other country on healthcare, but we have the worst health in the world. And how is that even possible? So there's
Mhm.
obviously something missing there. And then, yeah, I'm glad to be a part of the team here. And Jamie's great, and hopefully I'll get to meet all the rest of you one day. But yeah, that's who I am, I guess.
Awesome. Thank you, Frankie.
Welcome, Ricky.
Julie, would you like to pipe in? She's like, I don't know.
There we go. Yes.
Mm.
So I'm Julie. I have a science, research science background and have been exploring energy healing. And I am helping out with right now scheduling the roundtable events and making contact lists.
Mm. Yes, she's part of our outreach team, helping us gather all that. And then I've another woman here who is helping with design for Facebook posts, social media. I don't know if she wants to step forward. I'm not going to call you out because I know how she is. I
Yeah.
love her though.
I don't know. I'm Heather. Yes, I'm gonna do some design work. Social ads I've been working on already while I'm working. I just, in between jobs at work, just whipping them out for you. Whatever
Yeah,
else, whatever else artistically you need, I can help.
yeah, I
Okay.
appreciate that. I'll
Yeah.
probably be getting a hold of you afterwards. Okay, I need printables. Yeah, so that's a few people, and hopefully we can inspire more to come along. Basically, the last two slides, I'm kind of depressed because the last slide was pretty funny. Um, the it was really the last slide was just talking about the things you can do. There's all sorts of different types of things people can do for us. There's um, you know, we need leadership in all the different towns of Oregon. That basically concludes the presentation. Thank you so much for being patient with me. Did any of you guys have any questions?
I just have a comment and I want to just express kudos to all of you and Jamie having the courage and the prompting in the last, several years to step this forward. I think it's brilliant and it's so needed. And I would so love to be a part of it. Thank you, Suzanne, for letting me know that this is something that you're into. And yeah, you are going to be instrumental in this mission for sure. And I have joy of well-being. That's my practice. And I've been wanting to expand and make a greater impact. So I'm here in Bend,
Great.
and I would love to be a part of this. I can't think of anything more important than our well-being. My background has been mainly in education at the university system. Worked for Michigan State University and University of Nevada, but as a county extension educator, so not in a traditional education setting, although I've
Uh,
done some teaching and I've had certification in Eden Energy Medicine.
oh, no.
The real passion is helping people with their well-being and to share with them that life can be easier than what we think. And that's my mission. So
That's so true.
however
That's
I
so
can be a part of this.
I am going to drop in here a link in the chat, so you should see that pop up, and that has the application for the excuse me, volunteer. So that's a link you can follow, you can share to everyone. This is being recorded, so I'll be posting that, and you guys can share the this to everyone as well. And the more people we get, involved, I feel like we can actually make some moves. Something can happen. And I already see a change though, I mean, just talking to legislators and mental health care providers, there's this like spark of light happening. And it's fascinating to see that. And I hope to see that more and more as we go along.
We will.
Yeah.
Hey, hi. I like
Hi.
to say a little thing. Um, I've been doing energy work for 34 years, and
Mhm.
I particularly love working in hospitals for pre-op, especially, and prepping people for
Beautiful.
operations. And that's the type of work I love the most. Since COVID, I closed down my office in Portland, and I just do long distance work.
Mhm.
Um, and I have been waiting for somebody to take the reins on this so that I could just, be on call for hospital work and not have to try and figure it out myself. So I'm really excited.
Oh, yay, yay.
Yeah.
Thank you. Let's stay in touch.
Yeah,
And
and I saw that you have something coming up again on this coming weekend. Is that true? On the 11th?
the 11th, yes, we are going to be doing a healers roundtable. So where we're just kind of really discuss between healers what we think working alongside traditional healthcare can be. And I would love for you to be there because you've already done it.
Yeah.
And so
Uh,
you have a specific perspective that maybe
right.
some others don't.
What time is that? I think I'm gonna be at a Sundance, so I don't think I'll be able to leave and then go back and forth. But what time is it?
It starts at 1:30. And so we'll have the discussion for about an hour, hour and a
Okay.
half. And because this is our first roundtable, we're actually going to have some psychics there as a bonus. So you'll get a free reading if you'd like.
Great. Okay. I can't make it for that one, but I will be at the next one.
Okay,
Yeah.
great. We have another one on the 23rd, and that's a Thursday at, I want to say 6:30 p.m.
Okay. Okay.
And
I
that'll
I
be
can make that one.
posted as well. Mhm.
Okay, great. Wonderful.
Yeah.
And the way to keep in touch with that is just by
Yeah,
seeing
you can
Facebook
you can
posts.
keep a lookout for the posts. You can always message me your email and I'll make sure you're on the email list.
Okay,
Or you can just message and say, hey, what's happening
great.
next? Anybody else before we sign off? Yes, Lisa.
Um, I just, this is kind of interesting to watch all this come together because, I'm a mental health therapist, but I do intuitive work. So I have half my practice is like intuitive spiritual readings, and I really just kind of take people to the root issue. And then I do mental health on the other side. And then we own a holistic healing center in Salem, Oregon with a metaphysical store. We do tarot readings.
Mhm.
Um, we have like, probably about 17 clinicians and Reiki practitioners, massage, clinical hypnotherapy. So we kind of do like this whole piece, but I'm glad to see that you're working with like OHA and yeah, I'm impressed with you, Jamie. Like it's what you're doing because it was scary to do on my own, with my wife and I trying to kind of build our business because it's not always seen as credible. And so we've had to work really hard to stay credible. We're working with OHA right now and OHP and getting our clinic to be able to take insurance because we always have done private pay. And so we're
Yeah.
switching over with this economy and things like that and doing a piece of insurance. And then we are keeping our private practice because we could have never built what we did if we were under insurance because it's very controlling, like you said. And uh,
Right.
you kind of lose your ability to have that free spirit. But
Mhm.
I don't, if there's a way that we can help, we've done it for 25 years. And so to show you how we've navigated that system to keep our credibility and to bring in those models. And, the neat thing is we really work with people that are looking for something outside the box,
Mhm.
wounded from systems, either a relationship systems, a corporate system, a family system.
Yeah.
So I think there's really a need as the world is going through so much transition. I think you're absolutely on point that it is time as the glass ceiling is being broken that
Mm.
we can pick up the pieces and build something that was never allowed to be created before. And I'm just impressed with you and what you've done. So thank you.
Oh, thank you. Thank you. Yes, we will definitely talk. Yeah, if you're on board to, have a conversation about how, we can at least have you on as an advisory, or if you want to be
Yeah,
more involved, yeah, let's have a conversation later on and see how we can help each other.
sounds like a plan.
Awesome. Awesome. And then Suzanne, did you have something to say?
No, I'm just excited, Lisa. Yeah, this is exactly why we're doing this, to find out who's out there that can keep this going, spread the word. And that is what's been happening. I mean, these few conversations we've already had, people are very open and are saying this is an idea whose time has come. So,
Yeah.
very excited. Yeah.
Yep. Julie, I
Misty?
saw your hand up.
Yeah.
Yes, I wanted to say that the event on the 23rd is at 6 to 8.
Thank you.
And we are also planning on scheduling some virtual ones, so you won't have to be in Portland.
Yep. Yep. So, Julie keeps me on top of that stuff. You have no idea how good she is. Because like I got this whole laundry list of things to do, and she's like, knock knock, hello.
I'm sure.
And it
Did
works
you say it's
perfect.
6 o'clock, Julie? Okay,
Yes, 6 to 8.
6 to 8. Okay, super. Thank you.
Mm-hmm.
Perfect. Thank
I think
you.
Misty has
Mm-hmm.
hand up.
Hi.
Yeah, hi. I just wanted to introduce myself. I work out of Portland as a. Oh no, did I leave? Well, here I am
Nope.
again. Okay.
I see
Um,
you.
as an LMT, and my practice is based in Chinese medicine, so I do acupressure and energetic
Beautiful.
work. As a part of that, I didn't like really realize this is. I mean, it sounds like there's a Reiki and energy,
Yeah.
like
I
hypnotherapy.
just use that as an example because
No.
that's the modalities I use, and talking to people, they seem to know those words more than other stuff. So that's
Yeah,
just
yeah.
why. Yeah,
Okay.
but not
Um,
excluding you, I promise.
no, no. I'm looking at the ways where we connect and where, like, for 10 years, I've been trying to get massage to be more accessible to low
Hmm.
income clients and also pay myself a living slash comfortable wage. And that's really
Right.
hard. And we need people like you and all of us to figure out how to get us paid for this beautiful heart work.
Hmm.
Um, and
Hmm.
I've also I have my hands in a lot of pots. Like I work at Quest Center for Integrative Medicine, and it's all OHP clients getting acupuncture, massage, therapy, all kinds of
Yeah.
lovely services. And I do grief and rage expression workshops, and
Ooh, really?
yeah, and lots of work with the Grief House and some art,
Right.
painting portraits
Okay.
of our dead. And I'm
Yeah.
trying to figure out how to get can I get this work billed to make it more
Hmm.
accessible and get me
Right.
paid better. Uh,
Yeah. And that's
oh,
where kind of the legislation is going to come in because if we can get this bill passed, then OHA has no choice but to recognize us. And when we work with the health insurance companies, because we're recognized under Oregon Health Authority, we can easily get credentialed. And so eventually some of the funding that will be getting alongside, we'll have a couple big pots. The one big pot is going to be for, the scholarship program. But the other big pot is actually going to be for the healing arts practitioners for education on how to become credentialed with health insurance, because that is a beast in itself.
it is, yes, and
Mhm.
I've found that having a biller is very important as
Yeah,
well.
very
So
much so.
finding those, the people with the alignment to work with
Yeah.
is yeah. Uh,
Awesome.
The other thing is well, I'm sorry, who spoke? Oh, Frank, regarding grants. So if we do grants and put on events, and maybe you're one of the presenters on, or, do
Mhm.
some experiential learning and yeah, so I for one love to put on events like that. I'm in Central Oregon, but I'm assuming Jamie, eventually that's something else we want to do is put on events throughout the year to bring the
Mhm.
public in to learn about these modalities. And so, yeah, so that should be one of
Well,
the many things we're trying to
yeah,
accomplish.
exactly. There is if you guys know where Gresham is, there's a brand new library there, and they have an auditorium that fits 200 people. And so that because it is a library, it'd be free to use. And we just kind of kick them down a donation. So maybe doing some TED Talks, so to speak, would be pretty cool. And that, Misty, is where you can come in. You can talk about your work, and Tink as well, your work with Reiki, with surgical patients. All of us have like a little bit of something, or even just having a panel of people who have experienced the transformative effects. So we have all sorts of ideas. We just need some teams to put it all together and implement. Mhm. Is there anyone else that has any questions or thoughts?
Well, I feel like I have to say something now.
Yay.
I not a lot of people well, I can't say that. I'm this is happening at a wonderful time, Jamie, and I'm really, really glad that you're doing this, and thank you for inviting me to be a part of it. It's I am
Thank
a
you for
life
showing
coach.
up.
Yeah. I am a life coach. I do a lot of things, though I'm more of a creative. I'm also a spiritualist. I do all kinds of things in that realm. So I'm an actor, a filmmaker, composer, musician, singer. Any of those needs, I'd be glad to volunteer. I can do your TED Talks if you want. Help you with that.
Awesome.
Yeah.
That'd be great. That'd be
I
great.
don't.
And
I
I know you and Heather are gonna maybe collab on a project or two too, right?
Yeah, I do like I do light website stuff and creative things in that era too. I'm not
Yeah.
like an illustrator or anything, but I can help with
Oh, that's where
graphics and that
she's
kind of thing.
at. And
Perfect.
you can just help fill in the storyline, you know?
Right on. Yeah. So that's
Easy
just a
peasy.
little bit
And
about me. Yeah.
yeah, and the TED Talk thing, yeah, that's totally right up your alley, isn't
Totally.
it?
I love getting in front of an audience. I hate being a part of an audience. I hate being in a room full of people, but I don't for some reason I'm an introvert slash with extroverted qualities. I am autistic and ADHD. So I don't like being in the room with those people, but I don't mind being in front of them because I know where they all are. I can see them. See, that's how it
Right.
works.
Oh, that makes sense. That makes sense.
Yeah,
Your peripheral vision only goes so far.
that's right.
Yeah. Awesome. Great, Gil. I'm so happy to have you on board too. When I just knew it, I knew I should reach out to you, and there we go.
It was perfect timing.
Anybody else? So much for showing up. Thank you for being patient and giving me grace while I run through our presentation for the first time.